My paper is on feminism and psychology. In considering the influences of psychology on societal views toward women and the impact of the rise of feminism on the field of psychology, it is important to consider many factors. Developing an understanding of the role women played in the field of psychology leading up to the early 1970s, when feminism began to take place, is essential to understanding how these changes took place. Many women interested in pursuing scientific studies in the late 1800s through early 1900s were encouraged to enter the field of psychology, considered to be a soft science versus the hard sciences, like biology, chemistry, and physics. In spite of this pigeonholing, they were given little standing in the field, either by being blocked from attending prestigious academic programs, inability to obtain earned degrees, lack of having their work taken seriously, or even having their work attributed to a male. Due to this, many women were drawn to experimental psychology, as its findings were more difficult to argue. Additionally, they tended to perform studies related to differences in psychology between the sexes, as the male psychologists at the time had little interest in this area. Although women began to make inroads and gain status in the psychological sciences from the early 1900s to the 1940s, this also created some backlash from those in the field who opposed the inclusion of women. Alice Bryan was a female scientist who notably focused on publishing articles that provided survey data on women's contributions and common barriers to advancement. Her superiors were known to, on one hand, dismiss her work as having a feminist bias, but on the other hand, use her data to support their own findings without attributing the work to her. A few women were able to obtain leadership roles during this time period. Mary Calkins was the first female elected to be the president of the APA in 1905, while Margaret Washburn was the second female president of the APA, elected in 1921. Although these were huge accomplishments, they occurred during a period in which the APA was small. It took many decades following their presidencies for women to begin to regularly gain and maintain positions of power in the APA. One way in which this was controlled was the use of two-tiered membership, which was established in 1926. Male councilmen, who were considered fellows, were put in charge of making decisions about who would be moved from general membership to fellow status. Later documentation supported that this was done purposefully to keep women from rising to leadership positions. Although female membership rose to 30% by 1938, the number of female fellows was increased by only 1%. When the discrepancy was called into question, two of the high-profile men in the APA stated that women simply were not capable of performing the type of work that would allow them to be qualified for leadership positions. Female psychologists formed the National Council of Women Psychologists, or the NCWP, in 1941 when they felt they were not being taken seriously or their skills being fully used during World War II. Before this time period, female psychologists were typically relegated to research, while male psychologists performed the more applied work. The NCWP organized to demonstrate that several female researchers had applied research that could be better used to help traumatized combatants than male counterparts who were being placed in leadership positions during the war. Despite this, men remained the decision makers and most frequently ignored important findings by females that could have helped soldiers. Female psychologists were openly discouraged from competing for graduate work and gaining access to research opportunities. History is filled with stories of women not being allowed to apply to graduate school in the psychological services at Harvard, or needing to ask men for keys to be able to enter the laboratories. Even after completing the coursework necessary in successfully defending dissertations, women were routinely denied their degrees through the 1940s. Although women likely made many contributions to the field of psychology between the 1940s to early 1960s, their contributions were minimized and are not readily apparent in publications of that time period. It was not until the late 1960s to early 1970s that their contributions began to gain a foothold, as the ability of women to participate in the field of psychology coincided with the rise of feminism. Even then, their contributions struggled to find footing in the male-dominated area of study. As society began to hear about and internalize the stories of oppression due to the women's movement, the field of feminist theory and psychology grew. This was in no small part due to the influence of a seminal article written by Naomi Weinstein called Psychology Constructs the Female, or The Fantasy Life of the Male Psychologist, with some attention to the fantasies of his friends, the male biologist, and the male anthropologist. In this article, she used a feminist viewpoint to challenge beliefs in psychology that women's psychological issues were caused strictly by internal strife. She proposed that the theory at that time was predominantly driven by male-dominated culture and had little bearing in knowledge of women and the pressures caused for them by society. The paper was also a condemnation of the use of psychoanalysis used as a method to understand women. She used the behaviorist approach to support that the distress caused by women in relation to the oppressive stressors was caused by their male privilege-dominated environment. She voiced the need for a restructuring of psychological approach to allow for the understanding and treatment of psychological issues that affect women. Additionally, she called for the field of psychology to induce societal changes by providing empirical evidence to influence universal thinking about women's issues. The women's movement brought into light the idea of society's acceptance of excuses and expectations, perpetuating differences in expectations and treatment of women. As women began to share their experiences, stories of universal experiences and societal constructs that cause psychological stress began to develop. An example of this is that the women's movement brought to the forefront the issue of women being blamed for rape because they were walking alone or being dressed in a certain way. Several issues related to women's specific psychological pressures and well-being were focuses of the women's movement, including sex discrimination, workplace issues, violence against women, beliefs about women's sexuality, and reproductive issues. One of the issues that influences the psychological well-being of women is their exposure to the practice of sex discrimination. This exists within a full spectrum of intent, intensity, and effect, and in a variety of environments, including the workplace, schools, churches, families, and within the community. The underlying factor with sex discrimination is that a structure exists in which men maintain dominance and privilege to the detriment of women. Some of this discrimination is overt, such as companies which have a clear record of promoting men but not women. In some ways, this is easier to deal with, as there may be policies or laws in place that allow for a method of addressing these types of issues. However, even if this structure exists, many women would be discouraged from using it, as it might be expensive, non-productive, advised against by others who have been through the process, or might result in retribution from those who want to maintain the status quo. It may be the subtle forms of discrimination that occur on a daily basis that are more difficult to deal with when viewed as a whole. These behaviors are often seen as normal, or reacting to them may be seen as overreaction. Often, this type of discrimination occurs in the form of telling sexist jokes or reinforcing the ideas of traditional female roles, such as always asking only females in a working group to bring in cake to celebrate birthdays at work. This type of discrimination can be done purposefully to undermine women, or it can be done unknowingly as part of a social system that maintains these roles. Regardless, it is psychologically harmful to women and is oppressive, especially when considered as a cumulative effect. Sexual harassment is also considered to be a form of sex discrimination. Over 50% of women have reported being sexually harassed in the workplace or in academic settings. This type of exposure can lead to physical, emotional, social, and employment issues. Most of these harassments are never reported because women choose to deal with it due to fear of repercussions or lack of proof, or they prefer to move on to another job. The prevalence of sexual harassment and the message that women are largely receiving from society that they are overreacting or that they should accept it as part of their everyday life would certainly be expected to have a negative effect on psychological well-being. Exposure to sexual harassment has been described as trauma and is known to lead to emotional effects which are increased anxiety, depression, social withdrawal, interpersonal issues, and decreased self-esteem. Although women account for about half of the workforce in the United States, there are several inequalities that exist for them. One of the primary issues is the wage gap between what women make as compared to men. According to the Institute for Women's Policy Research, women make less than 3/4 of the hourly pay that men receive for the same work. This perpetuates the disproportionate amount of women who live in poverty as compared to men. Another issue is that women are not encouraged to go into non-traditional fields for women, such as engineering or the military. When they do so, they are often seen in a negative light by others. Additionally, women have the additional pressure of expectations for performing a higher amount of work at home to support the families, even when working the same amount of time per week as male partners. They also deal with a higher level of pressure to sacrifice their ability to work when obligations outside of work take precedence, such as taking off work when a child is sick, are needed. Although there are workplace policies and laws in place to protect the rights of women in the workplace, they are often violated in ways that are difficult to enforce, such as choosing not to hire a woman in competition with a man because they might need maternity leave in the future. As the rise of pro-feminism work occurred within the field of psychology, there was also a rise in psychological research by those outside the feminist movement, geared towards maintaining traditional female roles. Surprisingly, many of the researchers performing this work were females. An example of this is a theory by a female researcher that women did not achieve as much as men in the workplace because they had a fear of the consequences of success. Another example is the theory that women did not have the same social skills that men had and were more highly driven by approval from others versus gaining mastery. However, both of these theories were strongly opposed due to issues with the survey used and concerns with causal attributions. Before the women's movement, rape was largely viewed in society in the courts as occurring due to men struggling to overcome natural sexual urges. Feminism was largely successful in rebranding rape as being about the exertion of violence and power by men over women. Feminists promoted the ideas of date rape and marital rape, which brought about the idea of consent being a needed component for sexual encounters. The prevailing idea leading up to the late 1970s was that women who killed men that abused them repeatedly were morally and legally responsible for the harm because they could have left the situation at any time. Lenore Walker and Lynn Rosewater individually used existing research and assessment methods to develop theories for the women's behavior, which became the basis for battered women syndrome. They were able to show how pathology was previously misused to condemn abused women who could be more correctly used to enlighten the way in which their behaviors fit a predictable pattern caused by their environment rather than pre-existing internal issues. The explanation and legal precedents created by the description of battered women syndrome has, in many cases, allowed for correct attribution and diagnoses of these women. Additionally, appropriate effective treatment programs have been instituted for these survivors. Before feminist influences were exerted on the field of psychology, the focus in counseling in violent relationships used to be on simply removing the woman from the environment, then counseling her in the hope she would see the issues with the relationship and leave. This often failed because of the power the partner held over her, which would cause her to return to the violent situation. Feminists help identify that the intervention should be focused on changing the victim, even more so than the perpetrator. The feminist approach reframed the intervention to focus on the perpetrator while providing supports for the victim and working at a systems level to change the acceptance for issues that lead to the power differential. Much of what the field of psychology thought they understood about women's sexuality was extrapolated in assumptions based on research on male sexuality. Insight was even greater lacking when viewing the sexuality of women in a more specific manner, such as consideration of sexual orientation or ethnicity. Many of the messages received by women concerning sexuality from society tended to include elements of being victimized in coordination with the expression of sexuality. This includes some scare tactics, such as the ideas of unplanned pregnancy, moral peril, and being less desired by future partners. In comparison, these messages are sent less frequently and less intently to men concerning their sexuality. Additionally, focus on sexual desire tended to be viewed as more natural occurrence for men, but abnormal for women. Depictions of sexuality for women are often only depicted as heterosexual, further marginalizing those who identified their sexuality differently than the norm. Additionally, the general themes in fiction that has an element of sexuality often portrays male domination or unwanted sexual assault that results in romantic feelings. Girls and boys are frequently told in sex education to repress their sexuality until they were married. Also, some of these programs continue to place a responsibility on girls to dress appropriately so they do not draw sexual attention from boys. This wrongly places blame on women for unwanted sexual advances and promotes the belief that men struggle to control sexual urges more so than women. Until research was performed by Masters and Johnson and the Kinsey Institute, there was little information to help with understanding female sexuality. Among other things, this research provided information concerning the sexual behavior and experiences of women, predominant issues concerning sexuality, and how insight into how sexuality changed over the lifespan. Due to the impacts of sexuality on emotions and functioning, this information is important to have and understand when working with female clients. One of the main issues that women have to deal with universally are those related to reproduction. Due to many of the taboos and social views surrounding open discussion of these issues, many psychological pressures are unnecessarily placed on women. Oftentimes, women are viewed as being more aggressive or unpredictable during their periods. This is often overtly or covertly used within society to joke about or explain female behaviors or emotionality with no basis. Additionally, there are many issues that affect women surrounding contraception. Due to the methodology and lack of contraceptive methods that have been developed, most of the responsibility of contraceptive choice and use falls on the shoulders of women. The use of contraceptives sometimes results in health consequences, such as increased cancer risk or high blood pressure for women, which causes additional stress. These pressures can result in incorrect use of contraceptives, which can lead to unplanned pregnancies. Having knowledge of these issues is important for counselors who work with women so they can provide guidance or help clients overcome barriers to effective use. Women are also disproportionately affected by decision-making surrounding abortions as an alternative to unplanned pregnancies. Due to concerns with the morality of this decision, societal views, or fears of being ostracized, women often struggle to obtain the help they need to deal with feelings surrounding abortions. Women who become pregnant and give birth also face many emotional hurdles that may differ from the male experiences. They may deal with anxiety surrounding their health, changes in their body, or the childbirth process. Additionally, women who prenatally deal with mental health issues that are treated with medications may be required to make stressful decisions about whether or not to continue the medications during the pregnancy. Women who deal with infertility may deal with a high level of self-blame or stress. This can be highly impacted due to their view of their role as a woman that society places on them. Inability to become pregnant or carry a baby through full term may also be difficult to overcome without appropriate support. Additionally, many mothers develop postpartum depression. This is highly misunderstood by society and can be exacerbated by lack of support, isolation when dealing with a newborn, and a feeling that they should be able to work through the issue on their own. The feminist approach to these issues would be to provide a high level of support and psychoeducation to women and their families without assigning disproportional blame or expectations. The women's movement allowed for the increased awareness of women as a group of people who were being oppressed. It created an environment in which those in society and psychology were more aware of women's issues, so more strongly needed to consider women in contexts they had never been considered before. When women's issues were brought to the forefront in everyday conversation, media, and societal interactions by the women's movement, it became more likely for professionals to consider how these issues affect their female clients. As the view of society was recognized as largely males being in authority over women, the influences of this dominant thinking pattern and its influence on current understanding of psychology as relates to women could be more fully questioned. In other words, everything could then be questioned with a feminist sensitivity, which allowed for assumptions to be challenged. Within the field of psychology, this allowed for the questioning of diagnoses, reinterpretation of previous work, inclusion of women in research, development of interventions specific to women's needs, and consideration of lifetime oppression as affecting the psychology of women. Psychological diagnosis in the United States is performed via guidelines set by the American Psychological Association in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. An example of how the women's movement has influenced diagnoses issues that affect women was when the APA wanted to include paraphilic coercive disorder, or PCD, as a mental health disorder in the third revised edition of the DSM. PCD would have pathologized male criminal behaviors. The disorder was based on studies that supported a proportional increase between phallometric measures on rapists and effectiveness of hormone treatment to block sexual desires included with psychological treatment for offenders. The Women's Committee of the APA strongly opposed and ultimately blocked the inclusion of PCD based on their argument that there were studies which supported that rapists were driven by denigrating and having power over women rather than inherent physiology. There was historical disagreement between feminists on the need for women's group within professional psychological societies. Some feminists felt it was pointing out differences between male and female professionals, so there could not be a need for a separate women's group. In fact, many male professionals also stated that they thought the groups were unneeded because they did not see any inequalities in the profession. However, other feminists felt that these groups were essential to the ability to organize and better promote and advocate for women's issues in professional development. By the early 1950s, when presented with data concerning the discrepancy between female membership and leadership numbers, the APA found it difficult to deny the issue. The Association for Women in Psychology, or the AWP, was established at an APA meeting in 1969 in response to female psychologists' frustrations with what they viewed as sexist practices, assumptions, and lack of focus on women's issues within the APA and its annual conference. The individuals who created the association cited their successful participation in the women's liberation movement as increasing their awareness and willingness to confront the issues. They successfully lobbied for dedicated space, infrastructure, and resources to fund research into women's psychological issues. However, their demands for $1 million in reparations were ignored. In 1973, the AWP members were invited to create a division within the APA, Division 35, Psychology of Women. Although most members also became members of Division 35, they also continued membership in the AWP. Both groups currently continue to coexist and work in tandem with each other. The AWP created a lesbian caucus in 1975 in order to address the undue oppression and specific needs of lesbian members. Some important contributions of Division 35 have been creating common priorities for research concerning women, creating ethical guidelines to prevent sexual bias in research, developing a structure for collaborative work and to increase the ability to obtain research funding, and creating handbooks for professionals on women's issues and counseling. They focus on advocacy for women's issues within the APA. For example, successfully advocating that a resolution be passed not to allow the annual convention to be held in states that had not yet ratified the Equal Rights Amendment. The mid-1970s research indicated women were more likely than men to be diagnosed with depression and anxiety of men, reminiscent of the idea of female hysteria, whereas men were more likely than women to be diagnosed with personality disorders or substance abuse issues. Additionally, data at the time indicated that the vast majority of counselors were males, while the majority of clients were females. Women were also more likely to be diagnosed with a mental health disorder when they did not have one, then be unnecessarily medicated. During this time period, psychoanalysis was still a strong influence on societal thinking. Psychoanalysis argued that women struggled with Oedipal issues such as penis envy and freely expressing sexuality. Feminists such as Dr. Hannah Lerman and Nancy Chodorow began to challenge this male-dominated view of influences on female development. Dr. Lerman combined knowledge from existing theory, but within the context of what she had learned from working with women, in order to create a more refined, specific theory of how personality develops in women. Dr. Chodorow's approach used the prevailing psychoanalytic framework with different core developmental influences that considered females' drive to be mother-based or father-present. Females' drive to mother was based on father's presence or absence. Traditionally, psychological approaches to treating women focused on issues thought to be inherent or even genetically caused to their gender. An example is that women who had depression or anxiety who worked were thought to be experiencing those feelings because they were performing activities outside of their intended role. This divergence between their natural inclinations was seen to be the cause of distress. In contrast, a feminist approach would view this distress as being caused by the messages women are receiving from their social context, such as that they are not living up to their obligations to take care of their family if they work, or that they lack the ability to perform tasks men are able to perform. There is a high rate of disagreement within the psychological community about the differences in prevalence rates and psychological issues between genders. Some argue that differences are due to differential diagnoses that occur between men and women with the same symptoms profile based on differing views of etiology or expectations for the gender. Despite this issue, there are some consistent findings across study. As stated before, women are more likely to be diagnosed with anxiety, depressive, and bipolar disorders than men, while men are more likely than women to be diagnosed with substance abuse disorders. Women are up to 2 times as likely to be diagnosed with depression than men. Some argue this is because women are more likely to seek treatment than men, while others argue women are overdiagnosed. Support for depression overdiagnosis in women was given in a study in which male psychiatrists showed bias in diagnosing more cases based on files identified as women than they did when the same cases were identified as men. Studies indicated that women were almost twice as likely as men to be prescribed with antidepressants. Prevalence of generalized anxiety tends to trend higher in women as they age, although there is lack of data for women once they reach retirement age. The feminist approach would be likely to explain higher rates of depression and anxiety among women due to the additional pressures and issues they deal with based on societal oppression, such as greater likelihood they live in poverty, are affected by violence, or affected by gender role issues in the workplace. The AWP created the Feminist Therapy Institute in the 1980s, which provided ethical guidelines and training in order to be considered a feminist therapy. The Institute created a code of ethics and ethical decision-making model, which included therapists' knowledge of feminist-based counseling techniques, addressing cultural diversity and areas of oppression for their client, and maintenance of a balance of power within the client-therapist relationship. The ideas for structure for feminist therapy rely heavily on influential writings in the 1970s and 80s. Edna Rawlings and Diane Carter created a values list for feminist therapy based on a collection of writings they edited concerning the sexist nature of therapy at that time. The list included equality and power in therapy and relationships, abolishment of sex roles, the importance of promoting autonomy, promoting societal changes, correct attribution of women's issues, and confronting issues at the societal rather than the individual level. One counselor involved in the establishment of feminist therapy described it as to do therapy in a way that will allow each woman to observe how the submission of women may work against her in her case. Although feminist therapy initially focused on treatment of women by women, it has grown to include both male clients and practitioners who continue to focus on the social and political context of gender-focused issues. More recently, Feminist therapy has also begun to become more focused on highly oppressed groups of women, such as exploring differences in oppression in low SES, racial, ethnic, and other marginalized groups. The difference is the lens through which the issues which cause and perpetuate the psychological issues are viewed. For example, looking at differences in societal power for transgender individuals or adolescents. In this way, feminist therapy has many similarities to using a multicultural counseling approach, which some argue could encompass the feminist theory approach. Critics of feminist therapy state that the feminist approach is dated or too activist. However, women continue to be psychologically affected by issues specific to their gender, maintaining the relevance of the approach, especially as it endeavors to influence societal views. An important strength of feminist therapy is that it requires a collaborative approach in diagnosis as opposed to a more counselor-focused approach, which minimizes the power of the client. Using this approach, the client is seen as an expert. The counselor provides information, including potential consequences, regarding choosing diagnoses. The client and therapist discuss in concert the etiology of the issues, then discuss how the diagnoses might affect the approach to therapeutic sessions and reaching goals. Some argue the most important techniques feminist therapists use are those which are focused on empowering the client. Some of these methods include pointing out ways in which sex roles or societal beliefs have effects through the use of psychoeducation on feminist history or validation of experiences, especially when societal pressures or inequalities of power are discussed. These opportunities are often identified during sessions in the form of statements of self-blame or sense of unfairness caused by the client. Some feminist therapists incorporate the use of cognitive behavioral therapy techniques or hypnosis to challenge and deal with changing internalized belief systems, which have been created by buy-in to societal messages. Statements deferring to the expertise of the client versus the counselor are often used in feminist therapy. Additionally, this can be balanced with self-disclosure by the counselor of her own experiences to create the feeling of universality of experience with other women. Prominent feminist therapists state that it would not be possible for them to practice effective therapy without reflecting on and sharing pieces of their own personal stories of the effects of social context. Some feminist therapists reported that they were sometimes involved in direct advocacy on behalf of clients or to influence systemic changes. Many feminist therapists also encourage client involvement at the systemic level as a further way to feel empowerment. A feminist therapy ethical decision-making model is reported to be widely used within the approach to decide their level of involvement. In conclusion, a common theme for what constitutes effective therapy is that an individualized approach should be taken. Before the women's movement and the feminist influence on psychology, this was difficult to do because the issues that affect women were secondary to those that affected men. There was little true knowledge and understanding of the issues affecting the psychology of women. The frustrations of women with society and the forces within the field of psychology that work to maintain the status quo of male privilege came to a common tipping point with the rise of feminism. Although balance has not yet been found, the field of psychology has yielded to the pressures created by the movement, just not to the degree that some in the movement and profession had hoped for. It is a continuing phenomenon that requires advocacy at the systems level. The following passage speaks to this continuing need for growth in meeting women's needs. To ignore feminism's inability to transform psychology is to ignore the elephant in the room. Psychology itself is deeply implicated in creating the society that feminism seeks to change. To fail to transform psychology is to fail to transform society in a deep and fundamental way. As women's representation in psychology continues to grow, yet psychology becomes more entrenched in essentializing difference and maintaining a veneer of value neutrality. Feminist psychologists need to revitalize and extend the reach of feminism, embrace its political project, exploit its oppositional and generative potential, and amplify the disruptive voices of feminist researchers, past, present, and future. One researcher explained the feminist approach to therapy as a shift within a counselor that cannot be changed. She stated, that once you see the effects of social context on the psyche of women, it is not something that can be unseen. She further stated that, although it is not required to use a feminist therapeutic approach to be able to successfully treat women, it may be essential to have an understanding of feminism to provide them with effective treatment. Thank you.